Good evening. I'm Gracelyn Guyol, and welcome to Restoring Health Holistically. My guest this evening is Dr. Laura Munro. She's a naturopathic doctor who specializes in treating children and their behaviors. Welcome to the show. I want to tell the audience a little bit about you because it's pretty impressive. Dr. Laura Munro began her medical career in 1992 with an associate's degree in applied science and focus on physical therapy. As she worked in a variety of settings, orthopedics, inpatient, outpatient, and pediatrics, it was the children that inspired her to become a doctor. She graduated magna cum laude with a bachelor's degree from University of Connecticut in 2007, entered Southwest College of Naturopathic Medicine, and received her doctorate in 2011. From the year 2000 and 2003, Dr. Munro had also owned and operated Serenity Yoga Studios. There she witnessed the amazing healing that took place on the physical, spiritual, and mental emotional level, which caused her to believe that the holistic process demonstrates the body's innate ability to heal. Today, treatment with Dr. Munro is a collaboration between the patient and doctor to put the pieces of their medical puzzle together and help them take back their power to live a full, healthy life. Treatment options include nutrition, botanicals, hydrotherapy, craniosacral therapy, therapeutic yoga, acupuncture, and cleansing protocols. Today, I've asked her to talk specifically about children and behaviors, autism, attention deficit hyperactive disorder, and sensory processing disorders. So please define what the word behavior means.
Well, the actual definition is the way in which one acts or conducts oneself, especially toward others. Some synonyms would be things such as action or reaction, which I think is really an important way of looking at it. My personal belief is that behaviors are children's language. It's not their intention to be bad.
Right.
They want to tell us something.
They're communicating.
That's their communication, yes.
And what are the diagnoses that fall into this category?
So I think some of the most common are autism spectrum disorder, attention deficit disorder, attention hyperactivity disorder, and then some of the less common would be sensory processing disorder, as well as PANS, which also can be known as PANDAS, and that PAN stands for pediatric pediatric acute onset neuropsychiatric syndrome.
And will you be talking about the behaviors of PANS at some time?
I will be speaking about PANS a little bit more extensively.
So describe some of these common behaviors then.
So some things that we would think about would be fidgeting, nervousness, inability to focus or have attention, and we definitely think of those when we think of attention deficit disorder. However, that can also greatly be seen with sensory processing disorder. Then we have things such as chewing, spinning,
biting,
yes, biting and hitting, and again, that being the behavior that they're reacting or lashing out. Is something that we'll see often is in school, where the child will be in line and they'll hit the child in front of them, or they'll bite their parent or hit their parent. So those are a few of the behaviors that meltdowns is another big one that can occur.
And what about some of them are very sensitive to clothing, to baths, to a tag on their clothes that's uncomfortable?
Yes.
Particularly in the autism spectrum?
Autism spectrum, but that's also something greatly seen with sensory processing disorder.
Is it? Okay.
It is. It's their nervous system's inability to be able to take in the information and register what that information
and then turn that off.
And turns it on or off, because there's different levels of hypo or hyper, how reactive they are. There's also children who don't react to pain. That's another thing to think about.
Wow,
Where
I've not heard about not reacting.
Not reacting. So a child will put their hand on the oven and not realize that they've been burnt, or they'll fall and break their leg, and you don't recognize that, the child doesn't recognize that.
Wow. So given all these behaviors, then somebody has to interpret them. How do you do that?
Really, it's about getting all of the information possible from the parents, especially, and that includes their birth history and the pregnancy, and that's also extremely important information.
Why is that so important?
So previous would be how any medications that the mother had to take, or any diagnoses that she had during pregnancy. Also, whether or not it was a vaginal birth or if it was a C-section. Those are extremely important things to know, because we actually have pressure that happens to us when we are
Go
born.
through the birth
Go
canal.
through the birth canal.
Right.
So.
And you also pick up beneficial bacteria.
We
and
do.
things like
It's
that.
yes,
So
essential.
Okay. So, and you'll talk about that.
I will
later.
talk about that.
Okay. All right. So, how do you, when a child is brought to you, where do you start to figure out that child's puzzle?
So again, it's about getting the information from the parent, and just hearing and watching, observing how they sit, how they interact. Any information, extensive intake forms, so that the parent fills that out prior to us meeting, so that I can go through that, and it leads to more questions, as far as if they have difficulty with eating or swallowing, or don't like certain foods. All of those things, the picky eaters.
Right.
The picky eaters.
And
those
that's
are really
very
big.
common.
It's very common. There's a plethora of reasons that a child can have that,
Right.
from sensory to mineral deficiencies as well.
They crave certain things too.
Or don't crave. Vegetables is a big
Right.
one that they
Right.
don't actually like the taste of. So.
So what basic areas or systems do you consider?
There are definitely a lot of them, and I'll list out all of the ones that we'll touch upon. Infections, underlying infections is a large one. The nervous system, the gastrointestinal system as well, and how that interfaces with nutrition. Sleep, and
Another big one.
a huge one is toxins, and it's quite controversial for a lot of people, but it's a big thing that we need to consider in today's day and age. It's very different.
Right. That's right. It's, we look at our grandparents, and they really did not have the polluted environment in which we're living today. Every generation since World War II, when they started using a lot of the chemicals of war, came home, or the ones that they were developed for potential use in war, after the war they began being used as pesticides.
Yes.
And so each generation is now carrying not only what they inherited through their mothers, but what the child has added. And so I think we're reaching a tipping point where children can no longer handle the load that they're being given as a child.
It's actually a really huge piece of a lot of different diagnoses, and from the body burden. So it's the mother translates that to the child, and then how that interfaces, then how the mother her system is, and the genetics behind that, and then also the child. So the child comes in with a burden, and then they have their own ability or lack thereof
to throw it off.
To throw it off. And the liver, the intestines is a huge part of that, and the liver, which is one of my favorite organs, and it doesn't get a lot of recognition, but it does a tremendous amount of work if it's functioning properly.
Right. So talk about the heavy metals and the nervous system and oxidative stress a little bit?
Sure. So the heavy metals, so some of the bigger ones are mercury and lead are two of the main primary ones. You mentioned pesticides, herbicides. Those are also toxins that our body has to deal with. But specifically to go back to the heavy metals, mercury, so there's different forms of mercury. Some common ones are amalgams that are in our teeth.
Silver fillings.
The silver fillings.
Right.
Mercury from thermometers, which we don't have too much of anymore. They're still out there. There's mercury in light bulbs as well. And
fluorescent bulbs.
Fluorescent, exactly. And then we also have the vaccinations, which do carry some.
They've taken the mercury out of the children's vaccinations, I think. Thimerosal, since what, 2004?
Yes.
But adults should know that the mercury is still in adult flu vaccines.
There's a plethora of different things that are in vaccinations, and I'm definitely not against vaccines. I definitely think that there is a reasons to have them.
Some of them.
Some of them, and we have to be really cautious about that and just be educated and mindful of what they are and what they're doing. And it's about educating parents in that respect for the vaccinations. But to go back to how heavy metals affect our system, they're very neurotoxic.
Our nervous system is electrical.
It is electrical.
And so metals, it makes sense that metals would have a really heavy impact on them because they're great conductors of electricity.
It doesn't, our nervous system isn't necessarily electrical and conduction wise. The way that heavy metals really affects our nervous system is more through the fact that it will inhibit or bind to different nutrients that we need in order to continue to have the body function at its whole optimal level.
Okay.
So it's more a matter of where it starts to inhibit these abilities for these reactions to take place in the body.
That brings me to, I have extremely high lead levels, and I've been doing chelation for 18 months to try and bring those down. And the paragraph on what lead, the disorders that lead can cause is a very lengthy paragraph, and one of the things is that it disables the enzymes function, the digestive enzyme function.
Enzymes are proteins, basically. It's just it's a complex structure of proteins, really, with some other chemicals in there as well. And it not only affects the nervous system, but it affects glands, such as the thyroid gland. A lot of people are familiar with the thyroid gland.
Is that perhaps why we have such so much low thyroid
I think
function?
that it can definitely interface. I think that there's a lot of autoimmunity that is happening, and I think that it's a combination. I think as we age, it gets more and more complex.
Right.
So I think that those are some really big things. And chelation, it has to be, the person has to be in a really good place to undergo something like chelation.
Oh yeah, I had to have kidney and liver function tested to make sure that I was throwing off what we were pulling out.
All of our heavy metals or toxins are stored in our fat cells. So that's something else to keep in mind, that we store them there because our body doesn't know what to do with them. So it walls them off.
It takes them out of circulation and puts them in storage. It was my understanding also storage in organs, and the brain. Brain is an organ.
It's a very fatty organ.
That's right.
It's
60%
a very
fat.
fatty organ, and that's where that central nervous system piece comes into play.
Right. Okay.
So,
well, let's have you talk just quickly about pesticides specifically, and then you had hexachlorobenzene, which is a fungicide, and mercury. Just hit on those three.
So as far as the pesticides go, pesticides are meant to affect the nervous system of a pest, and that's what they do. They're sprayed on plants to kill them by affecting their nervous system. So why wouldn't that affect our nervous system is sort of the understanding of how that would interface with our bodies.
Right.
Again, being similar where it causes neurotoxicity is what we consider it. So that's that piece. The fungicide is the same. Pretty much most chemicals, herbicides, pesticides, fungicides, they all are affecting.
Designed to kill something.
Designed to kill something, exactly.
And even though we're a big something, we're bigger than bugs.
We are, but if you look at actually and go down to the microscopic level, there's a lot of similarities. Our mitochondria to each of our cells, mitochondria is within the cells. So they're all part of that.
And the mercury and the metals particularly cause a lot of free radical damage. So
yes,
discuss that.
Specifically to the mitochondria.
Right.
Again, going back to those complex proteins and how the mercury will bind to different structures and affecting the breakdown of.
Can you, it's fairly complicated, but can you just explain briefly what the mitochondria, that whole little section, because a lot of people may not be familiar with what this is.
Sure. So I think the most imperative thing to come out of that is that our energy, cells for the energy for our cells is comes from ATP. That is the energy currency or money of our cells. And the mitochondria are what make that. And they're very intricate little organisms that help to create that energy so that we can our cells can function and that we can function.
So if someone is always tired, always low in energy, then they need to explore what's happening with their mitochondria and support that.
It could be the mitochondria for sure. There's a lot of different, when it comes to fatigue,
yes, I know. Depression and
yes,
fatigue are linked too.
Huge
So there's, but I'm just saying
this.
the mitochondria is really the production of energy, and if you're constantly low on energy, it's one of the things that
It could,
you should,
it definitely
you could have. It could
be
be because of toxic overload.
Yep. And you brought up the free radicals, and I'd love to go back to that because I think that we toss around antioxidants. Everyone knows what antioxidants
And that we're supposed to take
are,
lots of them.
and that we're supposed to take lots of them, but what do they do? Why are we taking lots of them? And I'm sure everyone knows that berries are a great source of antioxidants. However, we have to be careful because there's a lot of toxins or the pesticides that can be
sprayed on them if they're not organic.
Organic, exactly. And there's a great resource out there, environmentalworkinggroup.org.
Oh, yes.
EWG.org is a phenomenal resource for people. But free radicals basically disrupt our body in a lot of different ways, and mitochondria being one of them, where it takes an electron. It's an electron, so that's what an antioxidant does. It actually gives up an electron to to a structure that might need that.
So it protects and it enhances energy production.
It actually protects and enhances, but it also, there's a lot of disruption in our, our DNA as well from free radicals, because the electrons they want to pair. They want to be buddied up with someone, and they don't care how they find that buddy. They'll take it from anyone. They just want to have a buddy.
All right. Tell me how, we're talking about children, and yet all of us and people who are considering having children are carrying a pretty heavy toxic load. What can prospective parents do to reduce their own toxic load so that they share less with the fetus to give them a better start on having not so much in this little tiny body?
I think first and foremost, one of the main things that we all should be aware of, and this is such a taboo subject in our society, unfortunately, but everyone does it, we should have frequent bowel movements. Our bowel movements should be regular, and regular doesn't mean once a week. Regular means once a day.
At least.
At least once a day. And there's different forms of how our stool should look. And it should be formed. It should look like a log or an S shape, sort of like a snake shape. And that's extremely important.
Because
if not, we recirculate the toxins.
Okay.
So I spoke about the liver a little
Right.
bit, and the liver processes all of these toxins, including the air we breathe and the pharmaceuticals that we ingest,
pills, the prescriptions that we take in.
and
the
foods,
pesticides on the foods.
and the pesticides in the foods, and just general body functioning. It makes a lot of things. It stores a lot of things. It does a lot of work. Hence the reason I love the organ so much. But the fact that once it goes through these two different phases in our liver, so that it can become water soluble, so we can excrete it out, is really important for our bowels to be working, so that we're not reuptaking those toxins. That's probably the most imperative thing for somebody to initially do, and then speak with a physician that would be able to see if there's anything else. Acute exposure is very important as well. What you acutely are exposed to, not just the chronic, where we may store something in our bones or our fat cells like we talked about before. So I think those are really important things to consider.
And also particularly if people have lived in older houses where there's
lead paint,
lead pipes, lead soldering in between the pipes, these are all things to be aware of, because that is actually where my lead came from. As a child, I lived on a farm that had lead pipes. And so I think it's important to be aware of your water source and your source of what you're putting on your lawns, not adding to the pesticide load, and also being aware of water and air and
food.
Yes,
food.
Organic as much as you can.
It's true, and I know it can be expensive, but there's a lot of things that we can do to decrease the loads that we're putting on our body, and to support the elimination of it. So I think those are really important.
I think we were going to talk a little bit about cleansing protocols. Was that?
So the biggest thing for me with cleansing protocols would be that the bowels, first and foremost, the bowels must be moving.
Okay.
And before anyone ever gets into any kind of a cleansing protocol or detoxification, as it's known out in the society and public, it's very common. I think that another really easy thing that we can do is contrast showers, hot and cold showers. So
known as hydrotherapy.
Known as hydrotherapy.
It might be a little hard to do that on kids. I do it myself.
Right.
But
you can do it with children in foot baths versus a shower.
Okay.
You can do it where you do hot and cold foot baths, alternating.
Or in the summer when it's hot, a cold. Kids get hot and then they run through a cold sprinkler. And that's great too.
Exactly.
So, and this is important. Can you explain about how the toxins interact with the nervous system and play a key role in the behaviors?
Sure. The nervous system is really essential, and I think that there's a lot of different aspects of the nervous system. And I think one of the main pieces of the nervous system is the sympathetic nervous system, which most people know as fight or flight.
Right.
That's a really big key thing that we should look at in children that we may say have behaviors that can't sit still, that are fidgeting, that are reactive, if you will, to outside stimuli. Because any of us know when you are fearful of something, that your heart rate will increase and your respiration increases and your eyes will dart around, and your nervous system is actually going into your peripheral system, meaning your muscles are what is being activated, your heart and your lungs, obviously,
so that you can escape a saber-toothed tiger or whatever's attacking you.
Right. Exactly.
And this is a very primitive part of our system.
Yes.
And so it doesn't understand that we have so much anxiety in today's culture, and I think it's because stress levels are so high. I have to do this, I have to do that, I have to do the next thing. And we're cramming so much into 24 hours a day that we have very high cortisol and stress hormones just from maneuvering through the day. It's not a tiger or something attacking us, it's sort of self-induced.
It is sort of self-induced, and I think that definitely our society is a big piece of that, and just how we are moving forward in our body. It is this innate.
Well, and we're pushing our children to be busy all the time.
We are pushing our children to be busy all the time.
And this can create a lot of this stress.
It can create a tremendous amount of stress, and then also, just going back and looking at a child who may have been born C-section, their body didn't get the stimulation that it should have gotten. And so that can set off, basically a whole host of continued issues. Dysfunctions in the central nervous system. And they continue to be that I spoke about being in line and hitting and biting, or hitting and biting a parent. They're in fight or flight. So if we're fighting,
so that triggers aggressive behavior.
It can trigger aggressive behavior because if you're gonna fight or you're gonna flee.
Right.
Those are the two things in that sympathetic nervous system that we want to do, and it definitely impacts our overall system. It impacts our sleep. It impacts our digestion. It impacts our ability to be able to cognitively focus. Because if you think that there's a threat at
you can't think clearly.
You cannot think clearly, therefore you can't learn.
Right.
So some of these children that are labeled attention deficit disorder may not have that.
They may just be
stuck in the sympathetic nervous system, this fight or flight, and that's where the sensory processing piece comes in as well. So that's really huge.
So do you want to talk about cortisol and chronic stress and the amygdala?
Sure.
And anxiety?
Cortisol will actually stimulate norepinephrine, which is another adrenaline type of a hormone, and that will actually stimulate the amygdala, which has to do with emotion. And then that will actually trigger anxiety in children.
So children who are constantly anxious, is it often the case, or are there many causes of the constant anxiety?
There's many causes of the constant anxiety, and actually in the beginning I brought up PANS or PANDAS, and that is there's a lot of information on PANDAS and PANS and how that actually does affect the amygdala and the basal ganglia. In the brain.
We don't have this later in our
it's earlier
conversation. So you talked about what it was, but describe it a little bit more in this context.
So basically, for anxiety specifically, there's different illnesses: bacterial illnesses, viral illnesses, fungal illnesses, Lyme disease, streptococcus, strep throat. Viral infections such as Epstein-Barr virus or mono.
Okay, so these all can contribute to anxiety because
they actually affect the brain and cause inflammation. For a very simplistic way of putting it, and it's a very acute and sudden onset for these children. So the anxiety will be increased. The obsessive compulsive type of disorders you'll see, actually tics, can
as in Tourette's.
Can actually be due to infections, chronic or underlying infections.
And do most psychiatrists know to test for these? I haven't heard this
Most
discussed.
Physicians don't. Test for this, are aware of it, very few. There are very few people in the medical field who are recognizing this. Although it's been around for a number of years.
Okay, but it's apparently not being taught in mainstream medicine.
No, it's not. Actually, we're working on getting some CME accreditation out there so that they can become more
awareness.
Exactly.
All right, so Then let's move on to how does digestion contribute to some of these problems? Nutrition and digestion, I guess, have to go hand in hand.
Hand in hand, and nutrition is so essential, but our nutrition comes from the gastrointestinal tract, and we talked a little bit about having good bowel movements in the liver, which are all part of the gastrointestinal tract. But some of the things that can really affect us, or that diagnoses that we'll look at, would be a dysbiosis, meaning that the bacteria in our GI tract that live there are affected or altered in some way. Antibiotic use is
wipes them out, the good and the bad.
The good ones. The antibiotics will actually kill the good bacteria that live in our GI tract, and we need to replenish them with probiotics, and that's very common today, and most physicians do recommend taking a probiotic with an antibiotic, although we shouldn't take them at the same time.
Right.
Because
we should take them
alternately, not with the antibiotics, since antibiotics kill bacteria.
Right.
So we want to take the probiotic, which is bacteria that live in our GI tract, and put that into our good bacteria. So when the good bacteria get killed off, the bad bacteria that live in our gut, or the alternate bacteria, they get very excited. Yes, they get very excited and they take over.
Right.
And they overgrow, and that can cause a plethora of issues in our GI tract, including inflammation. So now we're not going to be absorbing nutrients properly. It can cause an overgrowth of yeast.
You can have leaky
candida.
gut.
Leaky gut syndrome is a big picture, and that's really an inflammation, actually, in the GI tract, and that can be from a dysbiosis or an imbalance of our GI flora, but it can be from there was a physician who discovered a polypeptide chain, which is just a bunch of amino acids linked together that comes out of gluten. And that hormone is called zonulin, and there's tight gap junctions in our GI tract that make up those cells of the intestine, and it tells those gap junctions to open. So now we have
leaky gut,
and we have tight gap junctions in our brain as well.
Oh, I didn't know that.
So yes, so if they're going to tell our zonulin, this hormone is telling those the body doesn't know if it's a tight gap junction in the GI tract or if it's a tight gap junction in the brain. So it's going to cause that potential of having this inflammation or enlargement.
And most of a lot of the major illnesses are fed or made worse by excessive inflammation. Heart disease, cancer, any mental disorder, all of these have inflammation as a factor, and rampant inflammation.
It is. It's a huge issue in a lot, as you mentioned, diseases or diagnoses today. But I think that so we go, then we have food allergies or food sensitivities. So there is a difference between food allergies and food sensitivities. An allergy is an immediate reaction, and a sensitivity is just something that the body is reacting to on a level. So in our small intestines, which is part of our GI tract, our nutrients is taken into the bloodstream. And when we have this leaky gut, we can have proteins or other forms of foods get into the bloodstream that's not supposed to be there.
Because they haven't digested properly, so it sets off an immune reaction.
Because they didn't digest properly, or because now we have this, we have these huge gaps where these big particles can get out.
Right. And
then that allows our body to react. Our immune system is reacting to something it's seeing. It doesn't know that it's not a invader that isn't.
It's something that's inappropriate and not in the right form, and so it mounts a defense.
Exactly.
And with my bipolar illness, I had leaky gut and didn't know it, of course, and had at least a dozen food allergies, not allergies, true allergies, sensitivities to things that I was eating on a regular basis. And so my inflammation levels were very high. And I'm only using myself as an example because I know this happens all the time in children with mental dysfunctions. And and it's very often not diagnosed.
It's a huge issue, not just in, it's just across the board. And children who have very large tonsils that affects their ability to breathe, or their adenoids are enlarged. Tonsils are our body's natural way of mounting the immune system's army. That's our place where we're making them. We need that to build the army to go against the viruses and the bacteria and the molds or whatever it is that is in there when it's appropriate. But it's about the body functioning wholly again, and has the wisdom, and if it has all of the components it needs, it can do the job well.
So what are some of those components in terms of the nutrients that people need to be sure that kids get adequate amounts? Because a lot of our food is processed, is totally stripped of nutrition. It's full of calories, full of fat, some of them unhealthy. So discuss what you would say to a parent about diet.
Diet's a huge piece of the puzzle, and proteins, so that's very, very important. We talked about amino acids. Amino acids are the building blocks for our neurotransmitters, the brain chemicals. It's very important. So proteins are foods such as, we're just really going back to basics. So proteins would be nuts and eggs and chicken, poultry, beef, cheese. So animal proteins, animal proteins tend to be cause more inflammation in the body, although that they're very important. But nuts, people don't want to eat them because they think there's so much fat in them that's bad.
But it's good fats.
Good fats. And we need those fats. We talked about how fatty the brain was, and that's so important.
And particularly in mental health, and that's what we're talking about in children. We need to find ways of getting kids to eat the essential fats. And so nuts, to the degree that they're not allergic, nuts, seeds, avocados, what else?
Coconut oil,
using olive oil
as well. Those are all really good fats. And then we have our wonderful essential fatty acids that come from our fish. However, you have to be really cautious with that as well because of the mercury levels
in fish, right?
And so as far as salmon's one of the best that we can possibly eat. However, it should only be wild caught Alaskan salmon. And tuna is one of the ones that is very high in mercury as well and should be extremely limited. Because
a lot of the large sport fish are very high in toxins, basically. So
sardines are a great source, but it's not an easy thing to get a child to
cultural.
eat.
If they grew up eating sardines, they'd like them. If they were Italian,
that's true.
When I go to the Italian market, I always get these wonderful sardines and anchovies.
Yes, and they have the low mercury because
they're small.
Yeah, exactly.
They haven't accumulated a lot.
Exactly.
Well, I don't know how much time we have left exactly, but I want us to not skip over sleep because it's so important for children. And sometimes it's a big struggle with children who have these syndromes to get them to calm down and to sleep. So give us advice on how to do that.
There's so many different things that we can do for children. I think some of the main things are no TVs in their rooms.
Okay.
That light is very alerting to the brain. We don't necessarily recognize it, but there is a gland in our brain called the pineal gland, and that gland responds to darkness, and it actually secretes melatonin, which most of us are aware of.
The natural sleep hormone.
The natural sleep hormone, and that's really essential. And if that light is on from computers, cell phones,
Alarm
TVs,
systems.
they all emit
Digital clocks.
all emit that light. It can be very disrupting. Night lights as well for children. It's still light in the room.
Right.
So using blackout curtains, removing as much of the light as possible from their bedrooms is extremely important.
We have a night light in the bathroom for sort of safety reasons, so that we don't trip and fall in the dark and create a bigger problem.
Right.
But find if I close the door and just have a little crack, then I'm very sensitive to light. And as soon as the sun comes up, I'm awake, which is not always when I want to be awake.
That's right.
So I do have shades and curtains, and I also, when I travel, I take a sleep mask.
The sleep masks are really wonderful. It's very challenging to have some
Kids,
children wear
yes.
those.
Yeah.
But as far as nightlights go, some children need that to go to
Security.
sleep. And parents can just turn them off when the
Yes.
child's asleep. It's another way of doing it. Warm baths before bed is another huge. Epsom salt baths or baths with essential oils, very limited essential oils, or even just an infuser with some essential oils. Lavender is very nice. Chamomile tea is extremely calming and wonderful for children. Those are some
Fennel
things.
herbs are very relaxing too.
Fennels,
Yeah.
it's a strong one to have children take.
Well, but I mean, if you mix it in with the chamomile, it's sometimes used as a relaxant.
It's wonderful for the digestion as well.
And
Fennel's phenomenal
I
for
love
digestion.
when I go to an Indian restaurant. I
chew it. It's
eat the fennel as I'm
so wonderful.
leaving.
Yes. So those, I think, are some of the main things to consider for children with sleep, and just, we didn't touch upon all of the potentiality of all of the hormones and the cortisol being elevated and all of those different pieces, but just those few little tidbits of information are really huge for children to be able to.
We'll talk about that a little bit. We seem to have some more time. So
Great.
Just go into a bit of the hormones and what can be done at that level for children when everything else doesn't seem to be working. Or maybe you start with hormone testing in some cases.
So I try to limit the amount of actual blood testing that I have to do on children.
They don't like the
They
needles.
don't. Most of them don't like needles. If it's necessary, then we do it. But
Right.
I do everything possible to take the information, to use my observational skills, to listen to the parents. It's so huge. Parents live with children 24/7. They know their children, and that's so important for us to hear what they have to say and what their thoughts are, and getting the history. Again, I talked about the birth history as well as the prenatal history, and all of those things are factors in that. And so, addressing the hormone piece, it's about the root cause and really getting to unearthing what that is. And we want to support the child as much as we can, but we don't want to put Band-Aids on them.
Right.
We want to
You don't wanna
address
treat
that
symptom by symptom
Correct.
because everything's connected. You need to
Correct.
get to the source,
Right.
the root.
The root. And so once we figure out what that root cause is, then it's about addressing all of those pieces. I think it's really important to keep in mind that as adults, the layers become thicker and thicker, the onion, and peeling back those layers. But children are a lot more simple. And it's a bit easier to figure out, and then to be able to address that. And coming back, magnesium is a huge thing, and that's where the Epsom salt baths are wonderful. It's very calming to the nervous system. And so that's something that's really important. And I didn't address that in the GI tract, but how all of the different, things that can happen in the gastrointestinal tract, and how the nutrients, if it isn't absorbed properly, how that will affect, if we take in good essential fatty acids or nutrients, minerals, or multivitamins, if we're not breaking those things down properly, and then we're not going to absorb them properly. And that's really, our digestion starts in our mouth, and then our stomach digests, and then the small intestines also digest, but that's where all the absorption takes place. And not only of those particles that may be leaking through, but also of our vitamins, A, D, E, K, our fat-soluble vitamins, our Bs, all of the minerals, the magnesiums and the zincs, and that are so essential for
Do you
much.
frequently, when you're dealing with more extreme dysfunctions in children, do you do testing for the essential nutrients and the essential fats as sort of a baseline?
Again, I don't like to have children undergo needles, and especially if that's a fear for them. I don't want to add, if there's anxiety is already an issue or anything like that, I don't want to add to that. So again, I really try to address it based on presentation and symptomology, and I do as much as possible before getting a baseline. There's so
Just
many
as
things
based on the individual, then,
based on the
rather
individual.
not a formula.
It's not, yes, and medicine is truly anatomy, physiology, and biochemistry. If we understand those things, we can figure out, for the most part, most of the time, what's happening. And I think that that's what's so important.
But it is really a process, and that's why
It is a process.
I like to use naturopathic doctors, because it is a collaborative process where you come in, you take the history, you do the exploration to figure out what pops up as the most likely causes.
Yes.
And then you explore them and try to fix them, but it is not an immediate fix, and that's part of what's, I think, the problem with conventional medicine is everybody wants to just take a pill and have it be solved, and they don't want to participate, and they want it now.
It's true. It definitely is a big thing, and I think that a lot of responsibility falls on the parents, which is challenging when you're dealing with a child with behavioral issues.
Yes.
Because you're so overwhelmed a lot of the time. So I do I love to work with families, because I want to help address the parents to be able to support them to be able to help deal with what's happening with their child, and so that they can be in a place to do all of those pieces that can be overwhelming.
It is.
And that there's no one pill that's going to fix it. And I think
Can you share with us, without using names or anything, a couple of instances that were very dramatic that come to mind?
Sure. A few different children. Boy, there's so many things. It's challenging because there's no protocol. I don't do protocols in my work. It is truly individual, case by case. One, I don't have all of the facts back yet, but one young patient that I'm working with who was diagnosed with ADD, and after speaking to her mother and taking all of the information, including her logs from school, and I went through every school log, looked at it and saw where the issues were. And there was definitely a nutritional component, because she wasn't getting the protein in the morning, and that's essential for the brain to function.
Because it's been fasting all night.
It's been fasting, and protein helps to sustain us, where our brain and our red blood cells, they do need glucose. So that's very important, which comes mainly from carbohydrates, but we can make it from fats as well. But so that was something that was lacking in her diet. She had a very carb heavy, or cereal, grains, breads, not that they're bad, but just didn't help to sustain her.
Well, everything is about balance.
Everything is about, and moderation and balance. And
so to me, every meal needs to have a little bit of carb, a little bit of protein, a lot of nutrients, a little bit of fat.
Yes, exactly.
And then your body's getting everything it needs all at the same time to use. I mean, it would be like expecting to to make something, I don't know why it comes to mind, but mixing cement, and if you only had one component at a time, you wouldn't be successful in ever getting it to come together and to set up.
Right.
And I think the body, that's why so many people, if they are wealthy enough to, as in this country, to afford 3 meals a day, they have 3 meals a day, because you're getting a little bit of nutrition that keeps fueling all the cellular functions and keeps the energy even, rather than peaks and valleys or vast times when you're without food. It's a stressor for the body, and you get all the stress hormones coming out.
Right.
I used to, this was when I was a teenager, of course, breakfast would be a donut and something, orange juice or something that would shoot my sugar levels skyrocketing, and I'd have no protein with it. And by 11 o'clock, I would literally be so weak, I could hardly hold the pencil, and I was almost shaking. I was feeling so anxious. And it was all diet.
Right, and that crash that you talked about, you spiked from that sugar, and then you
high.
crash. Again, here's a behavior. If a child's not getting the nutrients that their brain needs to function, how are they going to focus? How is it that they can sustain their muscles and to stay up? Our muscles need energy as well. Our red blood cells circulate the oxygen, and all that has everything to do with our cellular functions. We talked about the mitochondria and energy production. Well, we need oxygen for energy production as well. So there's so many pieces of the puzzle that get looked at, but that's a huge piece where the child's going to crash. And are they going to be irritable? Yes. Most of us know if we
don't
eat, we get cranky, and that's our children. They're being cranky, but their crankiness or if they're acting out isn't necessarily because they're telling us something, and it's how are we interpreting that information?
Well, and the behavior right before dinner is usually, that's when there's fights, that's when there's anger, that's when there's a lot of loud behavior and acting out and picking on your sister or brother because they're needing food and they don't know that. They're just acting in a way that's creating that behavior.
Exactly, because their bodies are telling them that they need that nutrients, but they don't know how to express that verbally to adults.
Well, and also it's the crankiness, that comes on you, and you don't really know why. You're just very abrupt, and as parents, we're hungry too. We're fixing dinner. They're racing around yelling and screaming. And so to me, that's a time when you have to really be aware of how nutrition impacts behavior.
Right, for sure. And I think that's a good thing, coming home and having a snack, a school snack. Well, we don't want to give them a donut or cookies. It should be nuts or apples with nut butter of some sort, not necessarily peanut butter. It can be other nut butters or something that's going to help to sustain them.
Or cheese. Some
cheese.
A little piece of cheese.
A little piece of cheese is good too. Dairy is a wonderful thing, but I just recall a cardiologist saying once that cheese was probably one of the worst possible things for our cardiovascular system. So for sure, it's one of the ones but it's still a great.
It's still an instant source of protein and portable protein.
Portable protein. And nuts. I mean, we don't have to refrigerate them to go back to, and it doesn't have to be peanuts. There's a lot of issues today.
Well, a lot of people who have digestive problems have a hard time because nuts are so hard to digest, and seeds too. So that works for some people and not for others.
And again, it's the individual. It comes down to the individual and what's going to work best for them.
Well, I think we've about covered our topic this evening, and I'm so thrilled to have you visit and spend time with us, and I appreciate your wisdom and sharing it with us. So I'm just told that we have 5 more minutes.
Oh, wonderful.
So
wonderful.
Let's go back and talk about, I would like to know a little bit more about the sensory processing disorder. So that's less well known, and I think
It is
that
less
would be
well known.
interesting.
So it's inability for the body to interpret information. And I spoke about that a little bit in the respect of underfunctioning or overfunctioning. So overfunctioning would be being sensitive to the tags, not wanting the hair cut or brushed, not wanting to take baths.
Not wanting to be touched?
Not wanting to be touched, or always wanting to have hugs, or banging into walls, or not being able, or touching the hot stove and not realizing it. So those would be more under registering, the really wanting a lot of hugs and whatnot. So I think that the other piece is that I'm talking about the peripheral system, the peripheral nervous system, or our sense of touch. But we also have a sense of smell, and the sense of sight, and the sense of hearing. All those senses can be altered. So a child who covers their ears when they're at a parade, they're over-registering the information. Likely that they're over-registering that information. Or the visual vestibular system, so the inner ear that tells us where we are in space. That's something else that children who love to be on rides that spin, or ones who don't want to be on those, it can be a misinterpretation of the information. So you can have different areas of the whole sensory system that are being affected, and they can be, one area can be overreacting and one area can be underreacting. So you have to look at that whole piece, them again as an entire entity, and what things are happening. Also, how that interplays with the learning or not being able to sit in a seat is that if they don't have good core tone. To sit here, we're using our abdominal muscles and our back muscles to maintain us in an upright position. And that if a child's weak and you'll see them slouch or they're just kind of fidgeting around in their seat, it's because they're trying to stimulate that part of their body to be able to stay alert. And we're slightly shifting, but sometimes they have these extreme movements.
Right.
So it's about getting that input or feedback into their body. So those are some things. The children that are banging into the walls, again, they're maybe trying to get sensation through their joints, but also through that sense of touch.
Okay. Thank you for explaining that, because that's something that I'm not very familiar with, and I appreciate that.
Sure.
We are at the end of our time.
Great.
I wanted to thank you again for coming and sharing with us, and I want to invite all of you to come next Wednesday night at 7 o'clock for another episode of Restoring Health Holistically. Thank you, and good night.